About 25% of adults are affected by varicose veins, which are more prevalent in women than in men. Dr. Anna Gasparyan, a vascular surgeon at Desert Regional Medical Center, explains who's at risk and the new treatment options for varicose veins.
So varicose veins are the large serpentine bulging veins that show right under the skin. Usually when patients get varicose veins, there's usually an underlying problem of why this is happening. As the heart pumps, the arteries bring the blood down to the legs. And the veins are the vessels that bring the blood back towards the heart again. Well, if you consider the veins as a tube and the blood is trying to go back up against gravity, there's going to be a burden for the blood to try to go up against gravity in a tube. So inside our veins, we have valves. And as the blood goes up, the valves close. The blood goes up, the valves close. This is a system of how the blood is able to make it all the way to the heart, fighting gravity. And so as we get older, age, genetics, put on weight a little bit, obesity is a factor, then these valves start to malfunction. And so when they malfunction, instead of completely closing, they partially close and the blood ends up leaking down. So this is, for a lack of a better word, leaky valve syndrome, or another medical word for it is venous insufficiency. Varicose veins become a problem when they cause pain and debilitation to the patient. When it does become very painful, achy, the legs will have heaviness feeling to them, and the skin around the ankles will become discolored. When that happens, then the varicose veins need to be treated, because then it becomes problematic.
Various procedures are used to treat varicose veins.
We have to treat the underlying leaky valve problem first prior to actually getting rid of the bulging varicose veins. And so to treat the venous insufficiency component, it's usually a minimally invasive procedure where we use ultrasound and find the vein and place a needle with a catheter inside the vein that's the vein that the valves are not working at. Eventually, we put fluid around this vein, which is an anesthetic and a cold saline solution, so that the patients will not feel any pain from the procedure. And then we burn the vein with either using radiofrequency or using laser. There is also another treatment which is called the VenaSeal, and that is essentially placing glue inside the vein that the valves are not working in, which also has good results. The second portion of treating the varicose veins would be after undergoing the venous insufficiency testing and the ablation or the gluing procedure. One would proceed with either excising the varicosities that are bulging, which is called a stab phlebectomy, where we make tiny little incisions and remove all the extra bulging veins if there are any left over. Or the second option is injecting a sclerosant solution into the vein so that the veins cinch down and become almost invisible. These procedures are fairly successful, anywhere from 97 to 99 percentile success rate. Part of this whole process is prior to undergoing any procedures for your varicose veins, the patients have to wear compression stockings, elevate the legs, and be compliant in doing so, as this really aids in the procedure that we do for the varicose veins.
For an appointment, call Dr. Gasparyan at 760-902-1511.